Pardon me?
Oh,
Ready?
things going.
They're going fine.
Hi, everyone. Welcome to another episode of Everything Suffolk. My name's Brian. I'm here with County Executive Ed Romaine, Deputy County Executive Sylvia Diaz of Health, Human Services, and Education, as well as our our Commissioner of D.S.S, Dr. Imhof. Thank you all for being here.
It's a pleasure to be here, particularly with the two professionals sitting across from me. They've done a great job. Our social service department is our largest department in county government, and it's one that's so vital because it helps so many people in so many different ways. It's not only people that need a little bit of help in life, but it's also helping children and a whole host of different people. And I'll let the commissioner talk about some of the things that he has to do as commissioner in that department.
Thank you very much, County Executive. As you said, D.S.S is the largest department in Suffolk County. We have over 1,000 employees, and a number of issues, came to my attention when I arrived 3.5 months ago. One, I was concerned about the morale in D.S.S. The employees, it was kind of a malaise, and I think that they did not even feel appreciated. And I realized from my experiences prior in Nassau County, D.S.S staff workers, they do life-saving work every single day. And unfortunately, very unfortunately, D.S.S sometimes is judged by newspaper headlines. One bad incident may happen and it makes the headlines, and that's people's perception of D.S.S. And it's so far from the truth. So one of our efforts is to work with the Public Relations Department here at Suffolk and get the good news out about social services and all the work they do. We house people every single day. The homelessness crisis in Suffolk is very serious, but thanks to Chief Deputy County Executive, we have not anyone is turned away anymore for housing. Everybody is admitted to one of our 62 shelters. And we have backup beds now just to make sure that no one is ever turned away. Our Child Protective Services, we are doing additional training. We've started a special program called blind removal. And blind removal is when there is a need to possibly remove children from a home. It is done without any identifying information concerning the parents or children. All we know is the parents, how many children, their ages, and nothing else that will identify any background. And it really is a state policy that attempts to remove any prejudicial assessment of families or make predetermined judgments. So we have a trainer currently working with the entire staff to help them understand how to engage in the blind removal process. And so far, I'm hearing that the feedback is very good. We reinstituted the Employee of the Month program. For a long time, there were no employees being recognized for their service. So we just recognize now our April 24 Employee of the Month, and each month we're going to be catching up with the employees that need to be recognized. We'll have a photograph taken of the employee. We'll send a newspaper article out, publishing in their local newspapers, and I think it contributes to improve morale.
So you mentioned a lot of different things. I just want to circle back to the housing thing, and maybe Sylvia, you could talk about this. When we're housing the homeless, who operates these shelters? Who is it? Is it us? Is it maybe other vendors? Could you maybe go into a little bit?
So we subcontract out those services to not-for-profit providers, where they provide additional case management services, assistance with our population reintegrating the community. They find not only additional affordable housing, but they also are able to provide sometimes support services like intensive case management. We might make determinations as to whether or not there's a mental health issue associated with the fact that the person presented as homeless. And so they assist us and coordinate with us to provide those services.
And then also, County Executive. I know, upon coming into office, you made some promises about D.S.S, especially in the wake of the Thomas Valby case. I don't know if you could speak a little bit to that, maybe some of its significance to you.
Well, the focus has to be on protecting children at all times and making sure that we provide a climate where people of limited means, particularly people without housing, will be housed, and making sure we provide those vital services. I don't see anyone in this county go hungry. We're working with Long Island Cares and some other not-for-profits. I don't see anyone in this county who needs housing to be without housing. And unfortunately, there are some people who have a mental health issue that even in the coldest night, we can't even recruit them to come to a warm shelter. But we have to provide housing, food, clothing, and means of substance for some of these people that are indigent.
I know we've made some good progress so far with SNAP. I don't know if Dr. Imhof or Dr. Diaz, if you want to talk a little about that,
Yeah,
some
we're
of the wait
good.
times.
We've made a number of changes in the
If I
matter.
could just interrupt
Oh,
you
I'm
one
sorry.
second.
I'm
Yeah,
sorry.
no. SNAP is our supplemental nutrition assistance program.
Right.
It's
Food stamps.
food
Right.
for the hungry.
That's right.
No one in this 21st century
Right.
in Suffolk County should go hungry and government ignore their request. So we know that Jesus once said the poor will always be with us. It's our job to try to provide for these people so they don't starve or go without shelter. And this is a key thing. And obviously, they're sometimes it's for what we do for the least among us is the most important. And this is one thing that social services does and tries to do. It's complicated because it involves human beings, and human beings are complicated people sometimes. But I'm going to turn it over to Mr. Imhof, Commissioner Imhof, to explain how his department deals with human dynamics in Suffolk County.
Well, there's a lot of training we do, number one. First of all, my relationship with my staff, 1,000 employees, I've told them we're colleagues. I know we have different titles, but we work together. We have to be a team. And unless we have teamwork, then we can't accomplish anything. In terms of the county executive mentioning SNAP, which used to be called food stamps, we've reinstituted a policy called expedited. In other words, people are immediately signed up for SNAP, for food stamps, so that no one will go hungry. Each of our centers, D.S.S centers throughout Suffolk County, each of them have their own pantry as well. And if someone comes to our window and said, I don't have any food yet for today, we'll give them a huge shopping bag full of whatever, and diapers if they have small children. So our priority are the human needs of our population. And we have 2,000 people homeless in Suffolk County, and 900 of them are children. So we have to also try and address the homeless issue. And I know that's something the county executive and his team are dealing with all the time. And the rates of housing expenses are very high. People are losing their jobs. People are selling their homes, and if they're renting out, they're evicting people as well. There's so many reasons for the homeless crisis. But we have to be there. We're the last stop of getting people safe and sound and fed. And once they do come into our shelters, we begin case management. We help them start doing training, going to vocational programs. We want to get them back into society, out of shelters, and feeling good about themselves again, because it's not a happy experience at all.
You want to make people as self-sufficient as you
Self-sufficient.
possibly
That's the word.
can be.
That's what I was looking for.
And
Self-sufficient.
determining eligibility is a very significant part of this. So there are folks who don't know that they're even eligible, and they might be approaching the food pantries. So we have eligibility staff out deployed at those centers, ground floor, making sure that if there's someone that's eligible for the SNAP benefits, that they get the application and process. So we're doing our part in supporting the community in that regard. And with regard to housing, we're not only looking at the shelter system, but we're looking more broadly at the availability of affordable housing. Because as housing becomes more affordable for sort of average persons, it's those persons that are in need that are able to access, other types of housing. So as apartments, we see a lot of construction going on across Suffolk County, across the island. Some of those apartments that are going up are not really affordable. But in some instances, when we make those apartments affordable, then it opens up apartments for other beneficiaries of our services who might avail themselves of those.
So I know we talked about some of the places where people can approach DSS for services, the different centers. You mentioned outreach. Are you going to different shelters, like outside of the county system, or for some people don't have access to a car, or maybe
Right.
public
So
transportation may not work for them?
Yeah, the case management services that the shelter providers are providing is on site. But we're also at locations like Pronto in Brentwood, where there's a food pantry available, and so we have staff deployed at those locations. We actually have staff deployed at Suffolk Community College. Believe it or not, there are many young college students who don't know how to avail themselves of the services that they qualify for. So we're deployed out in the community. We're out at public health fairs and forums where we can get the word out about the services that are available.
And then also another thing I did want to talk about. I know there have been some staffing changes at DSS, and there are some job openings. Where should well, I guess maybe just talk about the staffing changes first, and then I'd like to maybe hear about where they could go to inquire about these jobs.
Well, the staffing issue is serious. All departments in the county are experiencing staffing shortages, and it's difficult to find positions that people can take and then have a standard of living that helps them keep the job. We have people who, if they get a job, a higher offer, they will leave. We're working closely with the Department of Labor. We just had a job fair here at the Dennison Building, and we're currently planning another job fair, and it will be publicized in the newspaper. So we're trying to reach out and get people interested. The state also started a new program called the HELP program, which will give individuals an opportunity to start a job without having to take the civil service test. If they want to keep going in the position, eventually they will have to take the test. But we are filling some important positions with the HELP program, and we have training going on every day at DSS.
And we've also increased the starting salary levels. We've been able to be more competitive in terms of the salaries offered. It's not only about attracting new employees to the county in general, because we do have a crisis in terms of attracting and retaining employees, just like any other business in Suffolk County. This is a challenge we face, everywhere. So we're doing our best to engage young people, new graduates. Earlier this year, the county executive spoke to the School of Social Welfare dean at Stony Brook, and we talked about how we could engage some of their new graduates in becoming caseworkers at social services. Offering a competitive salary is a big deal, and we are at that point now offering upwards of $60,000 in starting salaries, plus great benefits to work in Suffolk County government.
And County Executive, in terms of the priorities that you see with DSS and some of the other work that they do, what would you grade to be the highest? I suppose we may have went over this with providing services, but are there any other priorities you see within DSS?
Yes, making sure that it's sufficient funded. All issues of government are issues of money. And
Right.
it's just, for example, we are living in a time where prices of goods are rising faster than salaries. It's called inflation. And people are looking at salaries and saying, I can do better. So recruiting and retaining staff is crucial because these people do some of the most important work, deal with some of the most difficult cases and people and problems, and they have to be on the top of their game to be effective and making sure we guide these people in the right direction and they can become sufficient, self-sufficient, and that's crucial. So making sure that there's sufficient money in terms of salaries that are attractive, getting help from civil service with the HELP program, where you don't have to take a test. You just have to meet the minimum qualifications, and we can hire you. And if you work for a year, you can become permanent, which is important because there's a lot of benefits. And in times, those benefits will wake some people up because not only is there salary, but you're in a pension program that if you work enough years, eventually when you retire, there's a pension there for you. And there's health benefits that are provided. So we're looking to recruit and retain the best. And we're in competition with a lot of other people. And we're in a time of inflation and economic uncertainty, which adds to that burden. So those are some of the challenges we faced. Obviously, making sure that there's adequate housing, code-compliant housing for people. Just because they're poor, they should not live in housing that is not code-compliant, isn't up to code. Just because they're poor, they should not be second-class citizens. And we know a lot of people, and you read about people who are tremendous success stories who came from great poverty and was motivated to move ahead. We have to provide the wherewithal, the structure, and the framework for people to give them the best life possible, because that's all we have. We're only here for a short period of time, and we want to make sure that everyone has the best life possible, even those of very limited means.
I know, Dr. Diaz, do you have anything to add about some of the priorities within D.S.S. or Health and Human Services?
Absolutely. Housing is critical. We know that we have to provide that level of stability for families to thrive. We have, people might not know this, but we have working poor families in our shelter systems. They go to work every day. They just cannot find housing. As Dr. Imhof said earlier, people are selling their real estate, moving on in retirement, and that leaves sort of the average person without a place to live for their families. So we're working on those types of initiatives, obviously access to any of the services that we can provide. And most recently, the county executive, in his first 90 days in office, formed a Health and Human Services Consortium, where he's brought together sort of the brilliant minds in the field who've come together to develop some pathways towards successful programming in the Health and Human Services realm. So we're advancing that. They're really the experts out there doing the work in the field, and so he's listening to them. He's met with this group quarterly for the past few months, and we're putting together a plan of action to improve the quality of life for folks within this county.
The county executive has been very clear that our goal, and it's our mission in D.S.S., is to maintain the dignity of every individual, to give them the respect and dignity they deserve, and if they don't feel that way, to help them restore it by our programs and services and by our outstanding staff at social services.
And I know we did talk a little bit about where people should go, to the different centers, to some of the outreach. When applying for social services, what information should people provide? What's commonly asked, or what should they come with?
Well, first, if they have access to a computer, to go online and look up the Department of Social Services and get all the information about the programs that are available.
And even if they don't have access, they can go to the public library, because almost every public library in Suffolk County provides computer access to people.
Right. And then when they come to the center, they will let our workers know specifically what their immediate needs are. Most often it's food and shelter. Increasingly Medicaid as well, which is the health insurance policy for individuals who do not have enough income to get private policies or other types of insurance. So Medicaid is also a life-saving plan for individuals, and we assist people with Medicaid applications.
I think that about concludes, unless anyone else has something else to add.
I just might add that
Absolutely.
this year, the county executive is hosting the first ever conference on creating transformational change for families involved in the child protective system. This is the first ever conference that brings together all the stakeholders involved in the child protection industry, including our district attorney's offices, our county attorney's office, obviously social services, the school social welfare, the county bar association, judges, and constituents. Our guest speaker at this conference is actually Katie Beers, who herself was a child who went through our child welfare system and experienced some just her journey was amazing, and so we're proud to have her as a guest speaker. And we are anticipating that this will be the first of many opportunities to bring all these stakeholders together to have them learn about how to work best within the system that they're all engaged in.
All right, we'll be sure to link all that information and some of the other information we talked about in the link of this video.
Great.
All right, thank you guys so much.
Thank you.
Appreciate it.
Thank you.
Thank you.
Great job.
Thank you.
Thank you. Thanks so much.
Here, you can have.